Joining us is the Deputy First Minister and Education Secretary for Scotland, John Swinney. Mr Swinney, good morning to you. What will the First Minister's route map out of lockdown look like?
What it will set out is a number of steps based on the progress that can be made in reducing the prevalence of coronavirus in our society, which will enable us to ease the lockdown restrictions that have been in place in Scotland now for about 8 weeks. And each step essentially will be guided by scientific evidence and advice, and we'll tread a very cautious course in relaxing the constraints that have been applied to members of the public.
So any point in me pressing you for any detail on that?
Well, the First Minister's making a parliamentary statement at 12:30, so I have to respect the fact that Parliament's got to hear the details of it first, Kay. But what I can say to you is that we're taking an approach which is designed to give clarity across a whole range of different areas, whether that's about business, about schools, about healthcare, about how families can meet up, all these different considerations, which I know have been a strain for members of the public over the last 8 weeks. We'll be setting out the different phases of how we can relax lockdown, provided everybody continues to practice the really good practice, essential around physical distancing, cough etiquette and hand washing, which is essential to tackle coronavirus.
OK, in which case, let me ask you about a couple of points, starting with care homes. 45% of all COVID deaths in Scotland have been in care homes. A report by a pro-independence think tank says that COVID-19 deaths in Scottish care homes is the single greatest failure in the devolved government. How do you reassure families that their loved ones are safe?
The brutality of coronavirus is that it affects older people in our society more acutely than younger members in our society, and disproportionately. So those in care homes are going to be at a risk because our care homes have people who are older and more frail as residents within those care homes. Now, what we have to do is make sure we have in place a strong supply of PPE for the staff, which is what we have done, that we have clinical supervision of the care homes by public health directors around Scotland, which we have done, that we put NHS nursing staff in to support the care homes in doing the really good work that they take forward to try to support residents, and that we have a testing regime in place that enables staff and residents to be tested.
OK, let me pick you up on that, if I may, because official Scottish guidance says those care home workers who test positive might still be made to carry on working in the short term if there's no one available to fill that role. So you've got these frail people who are the most vulnerable in society. You've got people who are working in these care homes, have been tested positive for COVID-19. You'd think they'd be straight out of there, but no, you're saying they should carry on working in some circumstances. How can that be right?
I think what we've got to make sure is that there is a safe level of support in place in care homes to meet the needs of residents. And that's why I make the point that NHS staff have been deployed in care homes where care homes have found it difficult to do that because of the fact that staff have fallen ill. So the NHS has been given, and our public health directors has been given a specific role to make sure that there is a good clinical direction within care homes, and that if it's necessary to put resources in place to support those care homes.
OK, so you are acknowledging, though, that some people who have tested positive for COVID-19 are still being allowed to work in care homes?
I think the comment that you're referring to is just about one particular comment about shifts being completed. Unless
there might be circumstances where there could be an unavoidable delay in replacing all test-positive staff immediately. This could create an unacceptable risk to the safety of the care being provided, is the interim guidance on COVID-19 PCR testing in care homes and the management of COVID-19 PCR test-positive residents and staff, 16th of May 2020. So I'm just clarifying with you, if I may, please, Deputy First Minister, are there, in some circumstances, people who have got COVID-19 who are still being allowed to work in care homes today?
Well, that's why I said to you, Kate, that we are putting NHS staff into care homes.
Is that a yes or a no?
Where there's a staffing difficulty, we put NHS staff into care homes to provide that support. And that's essential to make sure that the quality of support is in place to support elderly residents and to make sure that we're doing everything we can in care homes to tackle coronavirus.
OK, let's talk about the shortage of PPE for frontline staff then. Royal College of Nursing in Scotland saying around 51% reported that their members are being asked to reuse PPE that specifically says on that PPE that can only be used once. Is that the case?
Not to my knowledge, Kay, because I think what we've managed to do in Scotland is to have strong and adequate supplies of PPE across all sectors. As I said in my earlier answer, we've put a lot more PPE into care homes directly by the government. These are private care homes invariably, but we've put the PPE in direct from the government. The National Services Scotland, from the National Health Service, deploys PPE right across the health service in Scotland to make sure that staff are adequately supported.
OK, so that survey by the Royal College of Nursing in Scotland is wrong, or those frontline staff who are saying, half of them, that they're being asked to reuse PPE that's marked single use, they are being economical with the actuality, are they?
Well, I certainly haven't seen that information, Kay, but what
I'm surprised.
But what I can assure you about is that we've put in place directly to the National Health Service and to care homes in Scotland PPE to make sure that staff are able to undertake their activities safely for their protection and the protection of others.
Let me ask you about the Nike conference then, can I? 26th, 27th of February in Edinburgh. 70 delegates, 25 tested positive. The only reason that the others knew that they'd each been tested positive because there was a leak to one of your national newspapers. They had not been contacted. They had not been told about the potential exposure to other people. 25 out of 70 at the night conference in Edinburgh. Why did they not know?
What was put in place was an incident management team which did the contact tracing, which you were discussing earlier on in the programme, which pursues, based on clinical judgments, the contacts that would have had sufficient exposure to the individual who was a confirmed case of COVID, to make sure all of those contacts were followed up. Now, that was undertaken as part of the incident management exercise that was carried out. That was done fully and comprehensively under clinical leadership, as it should.
You weren't 2 metre distancing at that stage, were we? Anywhere in the United Kingdom at the end of February. If I was in a room in a conference with 70 other people and 24, 25 more of those had been tested positive for COVID-19, and I only found out about that potential exposure, even if I hadn't got it, because I saw it in the media, as opposed to being contacted by those people who were supposed to be keeping me safe and are shouting it from the rooftops every single day at their news conferences, I would be wondering whether that was being kept under wraps.
No, because an incident management team was established to follow up all of the contacts that...
So how did the other people not know that people in the same room as them at that conference had also got COVID-19?
Well, but surely the people who you're talking about would have been people who, if they'd had symptoms, would have then pursued the fact that they had symptoms. If they did not
What if they were asymptomatic?
Well, the individuals, if they had symptoms, they would have been able to...
And what if they were asymptomatic?
Well, they would be able to pursue the issues if they were symptomatic. But what I'm saying...
if they were asymptomatic, they didn't have any symptoms.
But what I'm saying is that the clinical judgments that were applied to ensure that all contacts that were relevant to be traced were followed up as a consequence of that incident being reported. And also,
you can understand why this causes concern, can't you, though?
Well, of course I understand. Everything about coronavirus causes concern. I understand that entirely. But what I'm trying to reassure you about, Kay, is the fact that where that case became, we became aware of that case, an incident management team was established. The proper contact tracing was undertaken about individuals who were involved, and as a consequence, people were identified and supported accordingly, and that took place across a number of different countries. Now, that's what contact tracing is all about, and it's been in this respect.
So just to upsum, that people who've got COVID-19 tested positive will not be in care homes in future. Single-use PPE will not be used on the front line in future, and stuff like this that happened with the night conference will not happen in future in Scotland. Is that fair to say?
Well, what I'm saying is that as we work through the coronavirus pandemic, we are taking every possible step we can to address the fact that this is a serious threat to public health. We've applied very restrictive measures to ensure that we've reduced the prevalence of coronavirus in our society. We are seeing from the death rates and from the occupancy of ICU beds that is having its effect, and we're moving in the right direction. And what we'll set out today is some of the early steps we can take to relax some of the constraints under which people have had to be operating because of the level of public compliance and support that we've experienced.
Unfortunately, we are out of time. Thanks very much indeed for answering all our questions this morning. We look forward to hearing from the First Minister at 12:30. Thank you.